What attracted me to Reno was really first and foremost about the entire package. What I enjoyed about the Sierra Neurosurgery Group is that they had a profound amount of respect for what I'm looking for in a career. And with a family and a wife and making a very big move after residency, I'm not looking for a job, or I wasn't looking for a job where I would be for a couple of years. I was looking for a job where I could spend my entire career in one place. And not only to get to know the community, but get to know my patients, and also a place where my kids could grow up and we could spend time as a family. I think I've received excellent training throughout my 7 years of neurosurgery residency. I come from Brown University, Rhode Island Hospital. Rhode Island Hospital is one of the 5 or 6 busiest emergency rooms in the country, so I've seen a tremendous amount of cranial trauma and spine trauma, cervical, thoracic, and lumbar. In addition to that, I've also had very, very good training in cerebral aneurysm treatment, degenerative spine, brain tumors, pediatric neurosurgery, and peripheral nerve as well, and vascular disease as well, especially carotid endarterectomies. And so I think throughout my entire residency, I've developed a very, very wide and varied experience and level of expertise in many, many different facets of neurosurgery. And to be honest with you, I enjoy all of them. Not one particular area within neurosurgery is something that I want to hone down on and do 100% of the time. I enjoy doing a wide variety of neurosurgical procedures. In terms of what my philosophy is in treating patients, I think it's important to know that I'm a very, very conservative practitioner. And by that I mean it's important to give patients a very, very honest and open understanding of what happens to them with the disease process that they may have, to be open and honest about what the risks and benefits of surgery are, and to be open about performance and technical skills, so that they go into every procedure, if that's what ends up happening, understanding or having as full an understanding as they can about what the consequences are. You know, I know that as good as I am as a technician, I know that no surgical procedure is perfect, and we don't have 100% success rates, and there are complications. And it's important to consider surgery only when we believe the patient will benefit. The chance that they'll benefit is much greater than the chance of a complication. And so in that sense, I'm very conservative about the people that I choose to offer surgery to. Many of the conversations that neurosurgeons have with patients and with families are very somber, important events in patients' lives and families' lives, and they often deal with death and dying. And I think it's important to understand that from a practitioner standpoint, I've had to deal with many of the same scenarios that I talk with my patients about and with their families. I've had family members pass away from neurosurgical diseases, and the conversations that I've had with physicians in that context have not always been productive ones. And sometimes it's because the practitioner hasn't been able to talk compassionately with me and with my family, but just as importantly, sometimes practitioners find it difficult to speak openly and honestly about death and dying, and I think that's a very, very important part of the job. I think naturally the most important part about any relationship is communication, and that's a two-way street. It's important for me to talk to the referring physician about why he or she may want to send a patient to me, and it's important for me to communicate back to them about what my thoughts are about what the treatment goals need to be or what the treatment process needs to be. So communication is the foundation of all of that. And my intention would be to personally talk with all of the referring physicians when they send patients to me, so they can understand what my philosophy is and also what my plan is.